By 8 o'clock every evening, millions of people are sitting on their couch, pressing their hands into their own legs, just trying to get some relief. The aching, the heaviness, that deep bone-tired feeling that has nothing to do with how much you walked today. The veins visible under the skin, twisted and raised, a map of everything going wrong beneath the surface. If that sounds familiar, I want you to understand something before we go any further. What you're feeling is not just cosmetic. It is not vanity. It is not complaining. Varicose veins and chronic venous insufficiency are real physiological conditions with real daily consequences. And the evening hours are when they punish you hardest because of how blood behaves after a full day of gravity working against it. I also want you to understand this. You are not helpless against it. There is a specific sequence of movements and positioning that takes under 5 minutes and works with the mechanics of your venous system to drain pooled blood, to reduce inflammation, and give your legs genuine relief, not temporary distraction, real relief. I've recommended this to patients for years. The ones who actually do it consistently tell me it changes their evenings entirely. Let me show you exactly how it works and exactly why. First, understand what you're actually dealing with. Your veins have one job: return blood to the heart. Arteries push blood out with the force of your heartbeat. Veins bring it back using a completely different system, a series of one-way valves that open and close as your surrounding muscles contract, essentially squeezing blood upward. When those valves weaken or fail, blood doesn't return efficiently. It pools in the lower legs. It creates pressure in the vein walls. The walls stretch and weaken further. The veins become visible, that twisted, ropey appearance under the skin. The surrounding tissue becomes inflamed and fluid accumulates, creating the heavy, swollen feeling that gets worse as the day goes on. This is not something that happened overnight. It develops over years. And while genetics, prolonged standing, pregnancy, and age all play a role, the consistent daily behavior that accelerates it most is simple: staying still too long. When your calf muscles don't move, your venous pump doesn't activate. Blood sits, pressure builds, damage compounds. The 5-minute ritual I'm about to walk you through addresses this directly. Every component is chosen for a specific mechanical or physiological reason. Skip steps and you lose the effect. Do it in order and you'll feel the difference the first night. Step 1, diaphragmatic breathing for 2 minutes. Lie flat on your back, no pillow under your head if possible, legs straight and uncrossed. Place one hand on your chest and one on your belly. Take a slow breath in through your nose for 4 counts. Your belly should rise, your chest should stay relatively still. Hold for 1 count. Exhale slowly through pursed lips for 6 counts. Feel your belly fall. Do this continuously for 2 full minutes before anything else. This is not a warm-up, this is a mechanism. Your diaphragm, the large dome-shaped muscle under your lungs, creates a pressure change in your thoracic cavity every time it contracts during inhalation. That pressure change acts like a suction pump for venous blood in the lower body, drawing it upward toward the heart. It's called the thoraco-abdominal pump, and it is one of the primary drivers of venous return, especially when you're lying still. A study published in the European Journal of Applied Physiology demonstrated that controlled diaphragmatic breathing in a supine position increased venous return velocity in the inferior vena cava, the large vein that drains your lower body, by up to 30% compared to shallow chest breathing. 30% from breathing correctly for 2 minutes. Most people with venous insufficiency are also chronic shallow breathers. The pump that's supposed to help their veins is barely functioning. This step reactivates it before you do anything else. Breathe in for 4, hold for 1, out for 6. 2 minutes. Don't rush past this. Step 2, ankle circles and alphabet tracing. Still lying flat, extend both legs. Lift both feet just slightly off the surface, enough to take the heel pressure away. Rotate both ankles slowly in full circles. 10 rotations clockwise, 10 counterclockwise. Move through the full range of motion deliberately. You should feel the pull through your Achilles, your calf, and the top of your foot. Then, using just your right foot, trace the letters of the alphabet in the air. Each letter should be roughly the size of a dinner plate, slow and deliberate. Then repeat with your left foot. This is your calf pump activation. The gastrocnemius and soleus muscles, your calf complex, are often called the second heart because of how critical they are to venous return. Every time they contract, they squeeze the deep veins of the lower leg and push blood upward. When you've been sitting or standing for hours, these muscles have been largely inactive, and that pump has stalled. In the next part, we'll finish this ritual.
Step 3. Legs up the wall. 3 minutes. This is the single most effective passive position for venous drainage in the lower extremities. And most people either don't do it or do it incorrectly. Sit sideways next to a wall, close enough that when you swing your legs up and lie back, your legs rest fully against the wall from heel to calf with your hips as close to the baseboard as comfortable. Your body should form a rough L shape. Arms relaxed at your sides or resting on your belly. Stay here for a minimum of 3 minutes. When your legs are elevated above your heart, gravity reverses its effect on venous blood. Blood that spent the entire day pooling in your lower legs begins to drain passively. The pressure inside distended veins decreases. The inflammatory fluid in surrounding tissue begins to redistribute. The aching, the heaviness, the throbbing, it begins to quiet down. A clinical study from the journal Phlebology found that leg elevation at this angle for just 5 minutes produced significant measurable reductions in lower leg circumference in patients with documented venous insufficiency, meaning the swelling was visibly and measurably reduced in that short time. While you're in this position, continue the diaphragmatic breathing from step 1. The combination of gravity-assisted drainage and thoracic pump activation creates a compounding effect that either element alone cannot match. If your hamstrings are too tight to get your hips close to the wall, place a folded blanket under your hips to reduce the angle. The elevation is what matters most. Perfect form matters less than actually doing it. For people with more severe symptoms, extending this phase to 5 or even 10 minutes magnifies the benefit considerably. The 3-minute prescription is the minimum for meaningful effect, not the ceiling. Step 4. Calf massage with upward strokes. Come out of the wall position by rolling to your side. Sit comfortably on the floor or move to a chair or couch edge. Using both hands, wrap your fingers around your lower calf just above the ankle. Apply moderate pressure, firm enough to feel, but not painful. Now, stroke both hands firmly upward toward the knee in one smooth motion. Lift off, return to the ankle. Repeat. This is effleurage, a specific manual technique used in lymphatic and venous drainage therapy. The direction is everything. Downward strokes do nothing for venous return. Upward strokes, applied with consistent moderate pressure, mechanically assist blood and lymphatic fluid toward the drainage points in the upper leg. Do 10 strokes on each calf, then move up to the thigh. Same technique. Firm upward strokes from just above the knee toward the groin. 10 strokes each thigh. Research from the Journal of Advanced Nursing found that lower limb massage using upward effleurage techniques significantly reduced perceived leg heaviness and pain scores in patients with varicose veins and venous insufficiency, with effects lasting well into the following morning in consistent practitioners. Do not use deep pressure directly over visible varicose veins themselves. Work beside them, not on top of them. The goal is moving fluid in the surrounding tissue and smaller vessels, not compressing damaged vein walls. Use a small amount of lotion or oil if your skin is dry. The friction reduction allows better contact pressure without skin irritation. Step 5. Compression and cold finish. If you wear compression stockings, and if you have diagnosed venous insufficiency, you likely should be, this is the time to put them on for the night if your physician has recommended overnight wear. If not, a firm compression sock worn for an hour after this ritual provides meaningful support during the period when your legs are most vulnerable to repooling. The cold finish is simple. A cool, damp cloth or small cold pack wrapped lightly around each calf for 30 to 60 seconds, immediately after the massage. Cold causes vasoconstriction, a slight tightening of the vessel walls, in superficial veins that have become lax and distended. This temporary constriction provides structural support and reduces the sensation of throbbing and burning that many people describe as their worst symptom. This is not a cure, but the immediate symptomatic relief it provides is real, and it signals to your nervous system that the ritual is complete, which over time conditions your body to begin relaxing into recovery mode when you start the sequence. The honest truth about what this does and doesn't do. This ritual will not make your varicose veins disappear. If visible vein damage is significant, medical intervention, whether sclerotherapy, laser treatment, or surgical options, may be appropriate, and you should discuss that with a vascular specialist. What this ritual does is manage the daily physiological consequences of venous insufficiency with precision. It reduces pooling, it decreases inflammation, it activates the natural drainage mechanisms your body already has but stops using effectively when you're sedentary. It makes evenings bearable in a way that elevating your feet on a pillow and hoping for the best simply cannot. 5 minutes, every evening, in order. Breathing, ankle movements, wall elevation, upward massage, cold finish. The patients I've seen commit to this consistently don't just feel better at night, They report less swelling by mid-afternoon the following day, less heaviness by evening the day after. Over weeks, the baseline improves because the cumulative fluid load is lower. That's not magic. That's physiology working the way it was designed to. When you give it the right conditions. Start tonight. Medically backed leg relief protocol. For more training, visit AI Infopedia. Start tonight.